Moving over to ALK, again, similarly to EGFR, ALK also for, especially when we're talking about lorlatinib, there are other resistance mechanisms which happen on target, be it I117N or L1198F and others. So that is, again, the mechanism of on-target resistance. There are other mechanisms such as the activation of other bypass signaling pathways, and similar to what I just described earlier, squamous cell transformation as well as the small cell lung transformation. And again, the resistance, and I think you'll see a theme emerging here that for each of these molecular subtypes, where we are trying to target the resistance, I think the common theme is to figure out whether the resistance is on target or off target, and then based on that, you kind of strategize in terms of what to do next. And so for ALK, if there is an on-target resistance, again, there are 4th generation TKIs currently being studied in clinical trials. There is preclinical activity against those compound mutations that I just showed. Again, PROTACs, there are a variety of PROTACs being studied preclinically, and then using antibody drug conjugates and other combination targeted therapies and chemotherapy when we are talking about the transformation subsets. And so for the 4th generation ALK TKIs that are currently in clinical trials, they are smaller, they are more compact, and so they have less of a steric hindrance. Essentially, they're easier to fit into the pocket where the mutations may actually cause the frontline therapies to have some difficulty to fit into those pockets. They're highly potent to both single and many lorlatinib resistant complex mutations. There are currently 2 different 4th generation ALK TKIs. There's TPX0131. These are some of the graphs showing preclinical activity, showing tumor shrinkage. And then there's also the NVL or nuvalent compound NVL655, which also is showing good activity in these compound mutations for ALK resistant, lorlatinib resistant ALK-driven metastatic non-small cell lung cancer. And here again, as we saw for the EGFR, there are a whole host of different trials ongoing, some for on-target resistance with 4th generation TKI, and others for trying to target the bypass mechanisms with other inhibitors. And then there are certain trials which are also incorporating the antibody drug conjugates that we talked about also into the second line. Just a couple of slides to talk about the less common. I guess KRAS is obviously more common. However, because we just had an approval a year or so ago, I think we're still trying to figure out the different mechanisms of resistance that we have. This is what we know so far in terms of acquired resistance. There is certain co-mutations for KRAS may confer innate resistance, but when we're talking about acquired resistance to frontline therapies, there is, again, you see that common theme emerging that maybe there are alterations in the target, there may be downstream activation of other pathways, there may be upregulation of the bypass signaling pathways, and transition to perhaps small cell type of lung cancer. And there are, again, variety of strategies that are currently ongoing, and some of them in clinical trials, targeting upstream, targeting the upstream SHP2 and SOS1 pathways, as well as targeting the downstream pathways with dual RAF and MEK inhibition, or MEK inhibitors that are currently available, such as trametinib.